PCSK inhibitor deficiency results in hereditary angioedema, which is characterized by edema of the skin, especially periorbital, Fig. 2.3, and mucosal surfaces. Autoimmune disorders are characterized by immune-mediated damage of tissues, 1% prevalence in the U.S., involves loss of self-tolerance. Autoimmune disease is more common in women, classically affects women of childbearing age. What is the etiology for autoimmune disease? It is likely an environmental trigger in genetically susceptible individuals, increased incidence in twins and associated with certain HLA subtypes. Systemic lupus erythematosus is more common in women, especially African American females. Anemia, thrombocytopenia, or leukopenia in SLE is due to autoantibodies against cell surface proteins. Most common causes of death in SLE: renal failure and infection. What is a classic finding for systemic lupus erythematosus? Liebman-Sachs endocarditis is characterized by small, sterile deposits on both sides of the mitral valve. What is the most common clinical features of systemic lupus erythematosus? Diffuse proliferative glomerulonephritis, though other patterns of injury also occur. What is the most common clinical features of systemic lupus erythematosus? Diffuse proliferative glomerulonephritis, though other patterns of injury also occur. Systemic lupus erythematosus and anemia, thrombocytopenia, or leukopenia is due to autoantibodies against cell surface proteins. What are common causes of death for SLE? Renal failure and infection. SLE is characterized by antinude antibody ANA, sensitive but not specific, and anti-dsDNA antibodies, highly specific. Antihistone antibody is characteristic of drug-induced SLE. What are some common causes of drug-induced SLE? 1. Hydralazine, precanamide, and isoniazid are common causes. 2. Removal of drug usually results in remission. 30% of what cases are associated with SLE? Antiphospholipid antibody syndrome. Antiphospholipid antibody syndrome is characterized by autoantibody against proteins bound to phospholipids. 2. In antiphospholipid antibody syndrome, what are the most common antibodies? Anticardiolipin and lupus anticoagulant. In antiphospholipid antibody syndrome, what tests are disrupted? Leads to false positive syphilis test and falsely elevated PTT lab studies, respectively. What does antiphospholipid antibody syndrome result in? Arterial and venous thrombosis including deep venous thrombosis, hepatic vein thrombosis, placental thrombosis, recurrent pregnancy loss, and stroke. What does antiphospholipid antibody syndrome require? Lifelong anticoagulation. What is Sjogren syndrome? Autoimmune destruction of lacrimal and salivary glands, lymphocyte-mediated damage, type 4 hypersensitivity, with fibrosis. Sjogren syndrome is characterized by ANA and anti-ribonucleoprotein antibodies anti-SSA, Rho and anti-SSB, LA. Sjogren syndrome is often associated with other autoimmune diseases, especially rheumatoid arthritis. Sjogren syndrome results in increased risk for B-cell, marginal zone, lymphoma, which presents as unilateral enlargement of the parotid gland late in disease course. Scleroderma is autoimmune tissue damage with activation of fibroblasts and deposition of collagen, fibrosis.